health, of working collaboratively with our labor and management partners, and just the operational challenges of actually implementing these practices and the reality on the ground are just a very challenging task. And I'm very thankful. The governor and the governor's office and the administration are very thankful for everyone's leadership as we problem solve and work through this together. And so I just want to thank the Department of Education and all of you school leaders throughout the state. Thank you.
Thank you, Ben. Thank you. And Ben is in the leadership of the governor's cabinet secretaries, and we thank you for your work there. I'm going to turn it back to Stephanie. She's going to take us through the conversation today. Our focus today is to share with you what we have been learning in our task force on how to safely reopen schools. We have a task force that has a number of breakout groups and has a number of practitioners, people who work in schools, who understand schools, to help guide us on what we need to do. We also work very closely with the Department of Health and Human Services and the Department of OSHA, so that we are thinking about working conditions and we're getting advice from experts. And today you'll hear from an expert from the Department of Public Health. And so you'll hear a little bit today from a number of practitioners, people who work in schools and who understand the unique needs of school communities. Our intention is to answer as many of your questions today as we can. I want to thank the thousands of school district leaders who have sent in questions to us ahead of today's web call. We intend to answer some of those questions today. We intend to answer all of them in our guidance that we are preparing to support you in your efforts on reopening. But we also understand that with over 1,000 districts, that many of you already are working on your own plans, on your own unique needs on how to reopen. And so we wanted to have this conversation today so that we can compare notes together with the guidance that we're working on at the state level and the guidance that you're working on at your local distance level together to ensure that we're synchronized in our message, we're synchronized in our planning, and if there's more that you need from us, that we hear it, and if there are things that we can learn from you, that you share it. And so we look forward to a very robust conversation today, but not our only conversation. I do want to mention that there'll be focus groups taking place in addition to today's focus conversation. We will be doing focus groups of teachers and classified staff, students and parents, and others in our educational community to get the best thinking. We're studying what other school districts are doing across our country. I have been directly involved in talking with state superintendents from across the country and have been convening conversations with state superintendents so that we can learn the best from them. We also study what's happening across the world and what other nations are doing to address the issues of reopening safely. So with that, I want to turn it over to our great Chief Deputy Superintendent at the Department of Education, Dr. Stephanie Gregson, to take us from here.
Great. Thank you, Superintendent Thurman, and thank you, Ben, for joining us today. As Superintendent Thurman mentioned, we've been working over the past several weeks with our education partners on our reopening task force, and we have representatives from our labor and management groups as part of that group. And we've learned from our task force members that there are many different recommendations coming out, and we understand that there are some questions that we still have not been able to answer. We appreciate our task force members' time and their innovative thinking on a very challenging situation. So from our task force, we focus our conversations on educational programs, health and safety, policy, and the fiscal implications for safely reopening. Under the educational programs, we've discussed the different types of learning environments schools may be thinking about, such as use of outdoor learning environments, different seating configurations within classroom, smaller classroom sizes, and what that means for school facilities. For the instructional programs, there's been discussion around blended learning models, such as students attending in-person instruction a few days a week, maybe certain grade levels, attending certain days of the week, while other grade levels are engaged in expanded learning opportunities, and then a designated day for distance learning and professional learning opportunities for teachers and staff. We've also discussed ways to maybe have, if you're a K-6 school, K-3 grades are in person attending class, and our upper grades are doing more of a distance learning blended approach. So we have been discussing different models that we've learned from not only across the state, but across from the country as well. Throughout the entire discussion, the mental health and well-being of our staff and students has been at the forefront of all thoughts and ideas. Our discussions have had a heavy emphasis on school-wide social emotional learning practices and intentional actions on creating community and relationships. Regarding health and safety, the task force members have focused their discussion on knowing school districts should work with their local county public health guidance and agencies first. They also have discussed what districts will need to consider for physical distancing in different areas across the campus and on buses, how to conduct temperature checks upon student and staff entering campus if necessary, school cleaning and hand washing ideas, sports activities, personal protective equipment for students and staff, and considerations for at-risk staff and students and quarantining situations. We've received over 300 comments from you about what these proposed cuts to education funding will mean for you. You're asking the hard questions about how you can safely reopening, balancing cuts to your budget and all the additional expenses that are greater than anticipated around distance learning and emergency protective equipment to ensure the safety of your teachers, support staff, and students. And as our Superintendent Thurman mentioned, we know and understand that, and we are working with our legislative partners and all of you in looking at how we can advocate for the future funding of education in these circumstances. As I said, we've been working with many partners during this time through our reopening task force and other areas. And so now we'd like to turn to our practitioner colleagues to hear their thoughts. Joining us today is Erica Jones, a teacher in Los Angeles and CTA board member, Ben Valdepena, a custodian and CSEA president. We've also worked with AXA and CESESA, so joining us today is Lorena Rubio, a principal from Orange County, and Cindy Martin, a superintendent from San Diego. We've invited them to share from their perspectives how they would design school reopening, including their concerns and their hopes. So Lorena, let's start with you.
Hi, good morning. I've been having a little issues with my bandwidth, so I'm hoping this works out well. Good morning. My name is Lorena Rubio from Jordan Academy at Orange Unified School District. Soy la señora Lorena Rubio, soy la directora de la Academia de Jordan en el distrito de Orange y me da un placer estar aquí presente hoy. Yo sé que no voy a poder interpretar toda mi plática hoy, pero quería decirles que es un honor estar aquí abogando para nuestras comunidades. It's a great honor to be here to advocate for our communities. I guess I will continue, sorry. Jordan is a Title I elementary school. Their return needs to be equitable. Most, not all, our students need to be at school 5 days a week. Students in special education, English learners, those identified with gaps and not be at school receiving services, resources, and face time to support all their needs. Although our OUSD has done a great job at having 98% of our student population have access to devices and has ensured thousands of hotspots to those who need them, our elementary students need to be at school. Our teachers and staff are working harder than ever, and we didn't think that was possible, to make sure students are getting what they need. But the truth of the matter is that in order to continue to properly close the achievement gap, our students need to be at school 5 days a week. And of course, following the CDC guidelines, and our district, Orange Unified, is ready and to be able to support us with our disinfecting and cleaning needs as needed. Now, at the social emotional front of all of this, all elementary school students need to be back at school. Just yesterday, I had a parent call me asking me for permission for having her student turn in work late because her daughter, her 5-year-old, was crying. Our young ones are exhibiting anxiety, and that's not good. Parents in Title I schools are doing the best they can with what they know how to do. But it's most difficult because they can monitor their children, watch them, make sure they're on their devices if the parents are home. But there is the hindrance of the English language and higher academic skills that they may not necessarily have. Even I have struggled to support the higher math skills for my own kids at home. How can we make this work? Like I mentioned, following CDC guidelines, and Orange Unified School District is ready to provide that support. Funding for smaller classes, and possibly a hybrid model. Hire instructional aides that will support half of the size of the class through the remote learning, because we have learned amazing things. When we first deployed in this adventure of remote learning, our students, and we've heard it resound throughout, that our teachers were quickly to join in professional development and to learn how to best support our students through the distance learning. Swapping classes with this instructional aid in the middle of the instructional day would be the optimal. And again, using all the great strategies and resources that we have learned through remote learning. But our students do need to be at school every day, all day. More on funding. Calculation numbers for concentration funds should be reimagined also, especially for schools just like that are at the cusp, just like Orange Unified School District is at a calculation number of 53%, where we know the magic number is 55. And if they could have those additional funds, our districts and other districts such as ours would have been able to support our high needs students population in a much better way. I know that with passion, focus, determination, and proper support, amazing things happen in education to support all student success. Again, thank you for the opportunity to be part of this discussion and to hear our optimal plan and the equitable plan for our students to return to school. Thank you.
Okay. Lorena, thank you so much for sharing your passion, your ideas, and thoughts. Your students are very lucky to have you. Thank you. We'd now like to ask Ben Valdepeña to share his thoughts.
Thank you all for the invitation to this. The first thing we need to open up schools is that we need a really serious, comprehensive plan on what's going to happen. Each of our school districts is going to adopt their own plan, but we need statewide. We need a plan, as a guideline for them to be able to work off of. I have been a custodian. I'm the president of the California School Employees Association, but I have been a custodian in my school district in Yucaipa for, going on 38 years. I know what it takes to open up a school district. I know what it takes to open up a school. But I don't know what it takes to open up a school in this, in the era of COVID-19. We currently, I know how much supplies that I need to buy to keep our school clean. But right now I really would not have any idea how many supplies or how much I need in order to sanitize the school every single day. I can be honest with you, I really don't even know if the 2 custodians that worked at the school where I worked would be able to keep up with the demand of constantly sanitizing the school. So we really are going to need to look into staffing ratios to make sure that there are enough people to handle all of it. I, for one, would hate to see our schools become a hub for transmitting this virus out into the communities. So we need to not only look after our kids and our students and our teachers and our classified staff and all of our administrators, but we need to look at the community as a whole. We need to be a shining light, I guess you could say, for the community to know that this is a safe place to be. And right now, that's going to be very difficult to do. I'm hearing daily already about layoffs to a lot of our classified staff. I'm finding it very difficult to figure out how we're going to maintain the safety levels that we need to have if our school districts are already laying off classified staff. We also need right now, more than ever, all of us, all of the unions, all of our legislators, everybody, the parents, we all need to work together. This is a time that we all need to be included in the plan. You can't have a plan for driving a bus and making it safe without including bus drivers in that plan. You can't have a plan on opening up an office without having the clerical staff included in that plan. And you cannot have a plan on opening up a school if you don't have all of the classified, the teachers and the administrators all working together on the plan. It is just critical at this time. I for one, know that I've always been lucky because as many years as I've been working for my school district, that quite often my input was asked for, but that doesn't happen everywhere. And like I'm saying right now, we all need to be able to work together at this time to make sure that we are all doing what we need to do to keep everybody safe. And it's at times like these that heroes come to the forefront. It's at times like these that we all need to shine. And opening a school isn't the job of one person at the school or the job of one person in a school district. It should be a combined effort from everybody. And the best laid out plans and the best plans for opening the schools are going to come from those school districts that include everybody in the planning. And I, for one, hope that that's a direction that we are all going to go in, because I have a lot of concerns about opening the schools without good planning. That planning even includes teaching the children the importance of wearing masks, teaching the children the importance of sanitizing, washing their hands. Last night, I was thinking of videos that could be produced, before schools even open, possibly a video of a bus driver showing the kids how to get on a bus and how to get off of a bus, how to act while you're on the bus. The same with the classroom. Have a video of the teacher showing this is where you sit. This is where you need to wash your hands after you come back from the playground. Possibly even have videos of the kids out on the playground showing them what social distancing looks like. We really need to have a major comprehensive plan in place in order to open up our schools. Again, just to make sure everybody is safe and that we're all working together. Thank you.
Thank you so much, Ben, for your honesty, your collaborative mindset, and reminding us how important the collaborative planning process will be in a successful reopening. I have to say that I remember my custodian from elementary school, Mr. Jim, every day in the cafeteria, helping every student ensure that they were understanding how to stay clean, how to stay safe in the cafeteria, and not only in the cafeteria, but also around the playground as well. Mr. Jim was everywhere. You remind me much of him. So thank you for sharing.
No problem.
I'd like to hand this over to Cindy Martin, Superintendent.
Thank you, Dr. Gregson. I appreciate the opportunity today, and thank you to Superintendent Thurman for giving us this opportunity. You've been our partners asking for constant feedback from the field about what this looks like and how to implement, and we appreciate that and the opportunity. And I want to say thank you to Lorena on the panel. Thank you, Lorena, for setting a vision around optimal and equitable. That's important that you put that frame together for us. And Ben, you know the cleaning needs, the facility needs, and what you said about this as a community as a whole, and schools can be a shining light. So I appreciate all of the fellow panelists this morning. Thank you so much. I am proud to speak on behalf of my fellow superintendents across the state of California, because from the start of this crisis, schools have been getting the job done for our families. In San Diego alone, we've distributed close to 2 million meals and more than 50,000 Chromebook computers. And we've trained our 5,000 educators to craft online, to take their craft online and to show what teaching looks like that way. That's amazing, extraordinary efforts. And I want to say a heartfelt thank you to our fellow superintendents, to our principals, to our teachers, to everybody that's been part of this effort. I know many of my colleagues all across the state have done the same thing, and they've done more. And yet today, we know that in our state, we still have students who are trying to do their schoolwork, and they're in the corner of a crowded apartment or at the same kitchen table. They're with their parents, they're working from home, and they're all trying to figure out how to learn in these conditions. And we know that even on its best day, distance learning doesn't work for all students, just doesn't. It truly disadvantages our most vulnerable students. There's no learning from home for our families without a home. We know this. Our state knows this. So right now, the current budget plan is a recipe for more distance and less learning. That's why we joined with Los Angeles, Long Beach, San Francisco Unified, Oakland Unified, Sacramento City, and 40 districts here in San Diego County alone to say that our students deserve more. This August, we want to get back to schools, and we want to go back safely. We want to open for families every day, because that's the only way our parents can get back to work. We want to maintain social distancing, because the way this virus impacts our young people is still largely unknown. So social distancing is important. We want a nurse in every school, because the pandemic is still in our communities, and we need to stop it from spreading. We want a counselor in every school, because our students are facing real trauma after not seeing their classmates for so many months. This is why we've asked the federal government for relief. It's why we've asked our state leaders to do more, including giving schools a portion of the state rainy day fund. Everyone remembers when the advocates were calling for the creation of the BSA in 2014. They said it would protect schools and public safety when times are bad. Well, times are bad, and we need those funds today. This is not politics. This is math. We cannot absorb a 10% cut in LCF funding at the same time that we're trying to do more to reopen safely. Thank you for this opportunity to address everybody today.
Thank you, Cindy. We appreciate your passion and what you've shared in the realities of some of the how. So now we'd like to hear from Erica Jones.
Good morning, Dr. Gregson, thank you. And thank you, Superintendent Thurman. I have to say, from an educator's perspective, the health and safety of all of our students and staff are, of course, a priority. But right now, across the state, you have educators really thinking about how they built a classroom based on a culture of collaboration with cooperative learning groups. And how do you really do that in a social distance manner, right? So we're grappling with, how do you change the culture of our classroom that we know meets the needs of our students? And we're struggling with that. And the reason we're struggling with that is because I lived through 2008. I have my collection of pink slips from 2008. I know the cuts that happened. I know how my class size increased overnight. And so looking at this, like what seems to be a very bleak future, how can we really imagine what our classrooms could be under the guidance of, science, right? And making sure our students are safe, but knowing that we have massive cuts coming, right? So this isn't the time right now to even think about layoffs. And I just wanted to give you a couple of statistics real quick. So a 10% cut, this is what it looks like in the classroom. It looks like $21,000 from our classroom taken. And we know that since 2008, we haven't even restored to pre-2008 levels, right? We already know our schools didn't have enough. We don't have full-time nurses. We don't have the social emotional personnel to really help our students and help the whole child. So it's really kind of scary right now to think about that. Here it is. We have to look at how are we going to meet the best needs of our students, right? And really uplifting our most marginalized, most vulnerable students. How are we going to meet their needs with less, right? So this is actually the time for a major investment in our students, where our students become the priority of this state. Class sizes have to be lowered in order to abide by social distancing, right? We need counselors, we need nurses, we need personnel that are going to help maintain a safe school community and school buildings, right? And this means like not only not laying off educators, but also education support professionals. It takes a village to educate a child. It really does take a village. And right now we should be looking at how do we actually uplift and support that village, knowing that during this crisis, our kids have been through so much, so much. They deserve more right now. They deserve more support, and they're going to need more support. And the social emotional well-being of our students and the educators who are part of that village, I think that should be our priority as we're having these really difficult and complicated conversations about what school will look like when we reopen. Also wanting to say that, and I think Ben brought this up, how all stakeholders need to be part of that conversation as far as what is it going to look like. And I have to say, when it comes to the instructional program, educators at the district level have to be part of that conversation as well, where yes, of course, we're giving guidance from the state, but then at the local level, we're actually able to discuss that as a collective and really look at what's going to be best for our schools and for our students. So, I have to say 2008 haunts me. It really does. It was a very scary time. I don't know how, we're looking at, okay, come fall, this is what it should look like. But, oh, by the way, there could be layoffs prior to that. And I just don't think I think we need some stability and security right now, knowing that funding public schools in California is going to be a priority and that this is a time that we need more, not less. Thank you.
Great. Thank you so much, Erica, for sharing the emphasis around our social emotional well-being of our students being the center of our village, right? Of what we wanted to do within our village. Our practitioners really talked about some of the hows that a lot of our questions have been asking, and starting with that equitable lens that Lorena spoke with, having a collaborative, collective planning process that Ben spoke to, ensuring that you're looking at the social emotional well-being of not only your students, but your staff, having school counselors, nurses, looking at your structure and infrastructure within your district and how to support all of those things can only be done with the village that you have within your community. So thank you from our practitioners to answer some of the questions around the how. We really appreciate it. We now have our Dr. Gil Chavez from the Department of Public Health to share some insights from the Department of Public Health.
Good morning. Can you hear me?
We can. Yes, we can, Dr. Chavez. Thank you.
Thank you. I'm actually joining by a phone. The operator kindly opened my line since I couldn't join you by video, so I apologize that you can't see me, but I hope you can hear me well. I want to really express my gratitude to the California Department of Education, Superintendent Thurman, and everybody on the call for allowing us to join you. We are privileged to have a great partnership with the California Department of Education and work very closely with you all hand in hand. What I wanted to do this morning very briefly is just outline from a California perspective our pandemic roadmap and how that applies to the reopening of schools, and then, of course, answer any questions you may have. So I think first I want to make sure that we are all reminded that until California is fully protected by having a vaccination and a full stock of treatments for COVID-19, our actions will have to be aligned to achieve 4 objectives. So everything we are doing is based on these 4 objectives. One is to ensure that in California we have the ability to care for all the sick within our hospitals, that anyone that becomes ill, whether it's due to COVID-19 or anything else, should be able to get optimal care. That we need to prevent infection in people who are at high risk for severe disease. That we need to build capacity to protect the health and well-being of the public in general. and that we recognize that these are very trying times and we need to reduce social, emotional, and economic disruptions. We also need to recognize that COVID-19 is not going away anytime soon, unfortunately. We believe in the best of cases, we will be dealing with COVID-19 for at least another year, if not more. As you know, there's a long way to go for us to have a vaccine that works, and then we need to get that vaccine in people's shoulders. So it's going to be a long, long haul. We also need to recognize that the modifications to the stay-at-home order in California must be guided by health risk and a commitment to equity. You have heard Governor Newsom multiple times during his press conferences speak very passionately about how every action that California takes is predicated in science, is predicated in data, and is predicated in our ability to protect our communities. And so we take no action without those premises in mind. And then, of course, we all need to be reminded that this is a community event and that we all in the community have to take responsibility to make sure that we protect one another. But we also recognize that the place where we just came out of, the very hard stay-at-home order, is just not very sustainable in the long haul, that it has an impact on our economy, it has an impact on poverty, and it has an impact on healthcare. And hence that we need to start moving in the direction that we have over the last several weeks to reopen many sectors in California. And so we have been doing that in a very thoughtful way, following 6 indicators that we believe are very, very, very critical. And those indicators include our ability to test. So you know that we have been doing a big push to increase our testing capacity in California. I'm very pleased to tell you that we have made huge inroads. We now are testing anywhere to 40 to 50,000 people every day. That is a big accomplishment, is right on target where Governor Newsom wanted us to be at this point in time. We also need to be able to identify people that are newly infected so that we can ensure they're isolated. We can ensure that we identify their contacts, and we can ensure that those contacts stay in quarantine so they don't infect others. And so we are working very closely with all of your local health officers in ensuring that we have that capacity in place. We also need to be able to protect those that are at high risk for COVID-19 and to have surge capacity in our healthcare system. A lot of what we have done in the last few months has really ensured that we have capacity to care for the very ill, and that capacity is very broad, and we are very pleased that that is the case. We need to make sure that there's therapeutics available for people that get sick, and as much as therapeutics are still under development, there are some very promising therapeutics coming into the market, including particularly remdesivir. Remdesivir is an antiviral that showed very promise to treat hospitalized patients. And we are acquiring a very large number of doses in California so that we can use those in our hospitals to prevent bad outcomes on people that become very severely ill. I think that we need the ability of businesses, including schools and childcare facilities, to support physical distancing. Physical distancing will continue to be critical in what we do for the foreseeable future. And we need to be able to determine when to reinstitute measures like the stay-at-home order. So we have actually developed what we call a resiliency roadmap that has many stages. Not to make this too long, there's four actual stages. The first stage was safety and preparedness, and we came out of that and did quite well. Stage 2 is the stage where we are now all in, and that is opening lower risk workplaces. So creating opportunities for lower risk sectors to adapt and to reopen, including potentially schools, and that's why we're having this conversation today. We have stage 3 and stage 4 coming in the future, months down the road possibly, That includes higher risk workplaces, and that includes at the very end what we would consider the end of the stay-at-home order that will allow us to open the highest of risk places. And so let me briefly just, I'll go over a couple of things on the reopening that I think will lay out for the conversation that we need to have. So you may know that on May 8th, we moved into stage 2 that reopened some of the areas of the state where we felt that we were prepared to do it based on the metrics we've been tracking, knowing that California is making very significant progress, that our hospitalizations are stable, that our capacity is where it needs to be. And in doing that, recognize that California is really not one single microcosm, that there are many communities and there are many realities in California, and hence that our actions need to be flexible to allow for local variation, knowing that there are communities that are more hardly impacted, more impacted more challengingly, and there are others that have less of an impact, so that we need to make sure that our actions are tailored to the risk in those individual communities. So while we are making changes statewide and opening different sectors statewide, we recognize that we needed to allow for some local variance. And so we developed a process by which we're working with local health officers in each of your counties, in each of your communities, in looking at the reality of those communities and having the local health officer provide to the California Department of Public Health some assurances that the risk in those communities is such that those communities should be allowed to move through the reopening phases in a faster fashion. So we now have over 24 counties who have done what we call a self-attestation by the health officer, where the health officer basically proves to us that they have the capacity and the level of risk to be lower than statewide, so they can move on an accelerated fashion. And it's in those communities where we are now allowing to the reopening of some sectors that were not to come into our statewide plan until later. So the reopening of schools potentially in the next few weeks is not one thing that we envision will be statewide, but it will be really based on going with counties where there is a variance, so that those counties can actually move in reopening schools in a faster fashion. So it's very important that you partner with your local health departments, that you're in close contact with them, because they know, number one, the conditions on the ground. Number two, they know if they, of course, have gotten a variance from us to start reopening sooner. And if so, start engaging with them on what the reopening will look like in your communities. As you heard throughout the presentations this morning, we are very clear that you need a roadmap and that we from the California Department of Public Health can provide guidance to you from a public health perspective, knowing the science, knowing the medical component of COVID-19, and provide some recommendations on what are ways in which you can safely reopen. But we are not going to provide edicts requiring you or forcing you to do anything that is just not going to work in your community and in your reality. So at the end of the day, our recommendations are for you to guide your steps, to guide your actions in close consultation with your local health department. We have, over the last couple of weeks, been working very closely with the superintendent and his staff in drafting guidance for school reopening. We are getting very close to having a document that can be shared more widely, and that will provide you the necessary background for you to start making more decisions that are going to be local. I think that you will find that there's a lot of things in our guidance that are common sense, and some that are, and all of them, absolutely all of them, are based on the latest science on COVID-19. But at the end of the day, all of those recommendations will have to be vetted locally and implemented locally. Only you know your schools, how they work, you know your local reality, you know your students, and you need to then implement those in a way that is workable in your own communities. So let me stop here. In the interest of time, I'm sure you'll have lots of questions, and I'll be happy to answer as much as I can.
Thank you, Dr. Chavez. Some of the questions we've been receiving around physical distancing around schools is, how do you do that with confined space within classrooms and also with smaller children? So have you, through the Department of Public Health, worked through some of that guidance for our schools?
Yes, we are, of course, our guidance as it comes out will have some further recommendations on how to manage that. We are aware that there is going to be challenging for many sectors, many settings, including schools, to maintain appropriate physical distancing. And so that there will be the need for us to ensure that we have additional safeguards in those areas, including screening of personnel, so that you ensure that we are not allowing people that may be sick from coming to work, that there's screening of students so that they are not coming in if they're sick, so that we need to work out what that might look like. Of course, that there may be the need for face coverings for faculty as well as potentially for students, recognizing that that is going to be very difficult to do for smaller children, younger children, and for folks who have health problems that prevent the use of masking. And then lastly, that to the extent that we can, ensuring that we don't do a lot of mixing of people within the school, so that we can cohort school by grade and by people that spend most of the day together, instead of mixing, so that if we were to have an event, we at least have this happen in a more confined part of the school, as opposed to in the entire school as a whole. So there's the kind of thinking that we're putting on our recommendations that will be coming out soon.
Great. Thank you, Dr. Chavez. You mentioned face masks. We have a lot of students, there's some concerns around having kindergartners and first graders being able to keep their masks on, and also some of our students who have sensory issues. Will your guidance include, and what can you say about helping our schools understand the face mask issue with our younger students and those that may have sensory issues?
I think I already covered that in my prior remark, where I said we're sensitive to the notion that you cannot require 100% of everybody to wear a mask, that masks have a place, but that we need to be cognitive that there are circumstances and there are individuals for whom masking may not be possible, and that we need to have alternatives for in those circumstances. So we will address that as much as we can in our guidance.
Okay, great. Thank you, Dr. Chavez. And can you just give us a hint about what other areas you are covering within your guidance?
Yeah, I mean, I think that we intend to have something that is pretty general for the various components that go into operating a school. I think that the California Department of Education knows your business better than we do. And so working with them has been very positive in saying, here are the kind of areas that are of concerns to schools. I know they have been holding focus groups and talking to all of you about your concerns and your interests, and so that will be reflected on the various areas that we include in our guidance.
Great. Well, thank you, Dr. Chavez, for those updates and that information. We look forward to the guidance from the Department of Public Health, because I know that will be extremely beneficial for our schools and ourselves within our reopening guidance as well. So thank you for joining us.
Thank you.
We know that our schools have had a few more questions. You've sent us quite a bit, and I know that some were answered throughout our time together, but there are still some remaining questions as many of you have started to engage in your planning processes for a fall reopening. We are working on the development of a reopening guidance document based on what we've learned from not only our task force members, but also our focus groups, from you today and all of your submissions around questions and concerns and the thoughts that you've been working through. And so we look forward to having that out to you quickly and shortly because we know that summer's happening and a lot of planning time happens over summer. And so over the next few weeks, you'll receive updates on that guidance through our COVID-19 weekly email. And if you would like to share your own district reopening plan to help better inform us, we would love to learn from your work. Please feel free to email your reopening plans to us at the covid19@cde.ca.gov email. Again, we thank you for joining us today. Superintendent Thurman, I'm going to hand this over to you.
Thank you, Dr. Gregson. Thank you for your excellent moderation of this conversation. I want to thank all the participants who shared. As you heard from Dr. Gregson and others, today was an opportunity for us to just share notes, to share a little bit of what we're hearing in our task force that is working on preparing the guidance, but to also make sure that as we were preparing that we were hearing from our stakeholders, from school districts, so that our guidance doesn't go past those that we intend to serve. And so I know many of you have questions and maybe even thought that the guidance was being delivered today. To clarify, as you heard, we will be providing that guidance to you literally in days and weeks to come. We're working through it quickly, but what you can expect at minimum is to get a weekly update, a snapshot of what it is that we're learning in real time, and to have experts like Dr. Chavez and others who can also give information that can inform the work that we know many of you are also doing in real time. I want to thank our participants on the panel, but I have to start with those who provided sign language interpretation here. I want to give thanks to you all. Thank you. As you look behind me, you'll see the mural, a beautiful mural that's been created by an alum of our school for serving deaf students. And so we want you to know that we have programs to support all students. We've been providing webinars on how to serve deaf and blind students, and the California Department of Education wants to be thoughtful for the needs of all of our students, regardless of ability. This task force has taken really everyone to come together, as all of our panelists have said. And it really has been humbling and inspiring to watch our educational community come together to answer these questions. And so I'll quickly thank our panelists, Dr. Chavez, Erica Jones, Lorena Rubio, Ben Valdepena, and Cindy Martin. Thank you for what you shared today. But I want you all to know that what's been informing this task force is the work of every educational association that you can imagine in our state. And I can give you just a few names so that you know that groups both representing a labor perspective and a management perspective have all come together, as we've heard from every one of our panelists, have come together to look through the lens of what's best for students and those who serve them, our staff who work in our schools. Just to give you a little bit from the list, we're grateful to CTA, the CFT, CSCA, SEIU, including State Council and Local 99, ASME, and the California Labor Federation. We've had a number of associations that represent administrators and school leaders, AXA and CSESA, the Small County Superintendents Association, CSBA and CASBO, just to give you a sense. As you've heard, this requires a coming together, and that is happening in ways that are so helpful. Again, today was a chance for us to do a little bit of focus group testing, to share what we've been hearing and thinking and planning, to match that up with what you're doing. Please send us your plans. We want to continue the conversation. The timeline for the guidance is imminent. We expect to release something in days to weeks to come. But every week, we will give you updates as we receive them. And of course, we're always available for your immediate questions and your consultation. Send your emails to covid19@cde.ca.gov. Call us, text us as you're doing. We want to hear from you. and certainly work through your associations, as all of your associations are part of this task force. I want to thank all the practitioners for sharing a very practical perspective about what is real. And we hear you loud and clear. You all need access to PPE. You need access to ways to arrange your personnel and your students that allow this to happen, that can't be done with cuts. And understand that we are working with the governor and the legislature on how we balance out the needs around our state budget. Clearly, we need support from the federal government. And all of us in our roles as citizens should be doing that, making sure that the federal government understands that California and all of our states need that support. While we're waiting for those conversations to play out, I'm grateful that our legislators are having conversations as well about the possibility of revenue that could help to offset the kinds of cuts that many of you have talked about that would impact our schools and impact the ability of you to do your work. I want to acknowledge Ben Cheetah, who's been working with us to keep us closely aligned with the governor's office and all the cabinet secretaries who are meeting around the clock, and so grateful to them. Our message is always the same. It's safety first. We cannot do this unless we can provide for the safety of our students and those who serve them. And so in that respect, know that while we're dealing with some unanswered questions around the fiscal impacts, know that we're not going to ask anyone to open a school if we cannot safely do that. We have to answer those questions, and we'll answer those questions together. But safety first is our foremost calculation and consideration about how we move forward. And so stay tuned for updates. Know that there are focus groups taking place across all sectors, and know that we will continue to share information as it comes in. I don't know about you, but I've never anticipated that I would experience what we're experiencing. I never thought I'd see this in our lifetime. I had to look up the word pandemic to understand that it means worldwide. We are dealing with something that is worldwide. And right now it is unrelenting. Even though we've made some progress in flattening the curve, the impacts of the pandemic are unrelenting. And as you heard from Dr. Chavez, we've got to think this through for the long haul. And with safety being our guidepost, we've got to think about how do we also provide a quality education to all of our students. I acknowledge to you up front that this is not easy. I acknowledge to you up front that there is no simple playbook for how to do this, but that through our collective efforts, we will provide the best thinking informed by science and healthcare professionals and others to really provide the best thinking about how we do this together. We have no choice but to rise to face this challenge, because our students deserve the opportunity to still receive a great education, even in the face of this challenge. And California is rising to meet this challenge. We have more to do, but we can do more together, and we are stronger together. And together we will serve the needs of our 6.2 million students and those who serve them in California. That's all for now. Stay tuned for updates and continue to stay well. Thank you.